These are the tingling side effects, but sometimes lead to dysfunction in everyday activities, such as buttoning shirts or blouses or tying shoes. And these are an important quality of life concern for our patients. And we have a presentation from Dr. Ellen Smith, an assistant professor at the School of Nursing at the University of Michigan on this subject. Dr. Smith.
Thank you, Dr. Vogelzang. And so I was going to begin with a brief explanation of what is chemotherapy-induced peripheral neuropathy. And so you've already heard this is a type of nerve damage that can occur as a result of the treatment with certain neurotoxic chemotherapeutic agents. The symptoms can be painful numbness, tingling, and electric shock type symptoms that tend to occur mainly in the feet and the hands. The problem is that although these chemotherapeutic agents can definitely prolong the lives of patients and potentially cure patients, there are some that end up with this chronic, debilitating problem. And by chronic, I mean that some patients endure this painful neuropathy for months and possibly for as long as years following completion of chemotherapy. And so it's chronic, it's very distressing and disabling. And then in addition, there really is nothing to date that we know is effective in treating this problem. And so our study was designed to test whether duloxetine, which is an antidepressant, at 60 milligrams a day, would be effective in decreasing painful neuropathy caused by two chemotherapeutic agents, specifically paclitaxel and oxaliplatin. We were also interested in assessing the side effects of duloxetine, as well as its effect on functional status and quality of life. This slide illustrates some of our results related to two main pain outcomes. The blue line in both of these white boxes reflect the data obtained from the patients who received received duloxetine. And the red line reflects the data from the patients who received placebo. In this first white box, you can see that the mean pain scores decreased in both groups, but decreased to a greater degree in the patients who received duloxetine. In the second white box, you can see that again, compared to placebo, the duloxetine-treated patients had a greater decrease in the amount that pain interfered with some very important things, with general activity, mood, walking, normal work, relations with people, sleep, and enjoyment of life. This slide illustrates the percentages of people who responded or who didn't respond to duloxetine. As reflected in the red bars, you can see that 59% of patients had a decrease in their pain as a result of duloxetine treatment. The placebo group also experienced a decrease in pain, however, to a lesser degree than the duloxetine patients. It is generally accepted that a 30% decrease in pain is clinically significant, meaning that that's important to patients. 33% of patients in the duloxetine group had at least a 30% decrease in pain, and 21% of patients had at least a 50% decrease in pain. Unfortunately, there is no drug that is completely effective for everyone. Pain actually increased in 11% of duloxetine-treated patients or remained unchanged in 30%. This slide illustrates that duloxetine was extremely well tolerated. The most common side effects were fatigue, which occurred in 7% of patients, insomnia, nausea, somnolence, and dizziness. As indicated by the red bars, you can see that the incidence of these side effects in our study were somewhat less than the incidence reported in two other studies where duloxetine had been tested for the treatment of diabetic-related painful neuropathy. Most of these side effects were considered to be moderate. 7% of patients reported severe side effects, and 11% of patients dropped out because of side effects. So in conclusion, we can say that duloxetine at 60 milligrams a day is the first drug to be shown to be effective in painful chemotherapy-induced peripheral neuropathy based on the results of a randomized controlled trial. It decreases chronic CIPN pain severity in the majority of patients who take it. It improves function and quality of life. It's very well tolerated. And we can say that there are fewer side effects associated with a lower starting dose. What I neglected to say is that in our study, patients were started on 30 milligrams before ramping up to 60 milligrams, which is in contrast to the other two studies where patients were started on 60 milligrams immediately. And then lastly, I'd like just to say a few words about where we're thinking we're going to take this. And so as I mentioned, not everyone responded to duloxetine. Because duloxetine works by increasing the amount of some pain-inhibiting neurotransmitters or chemicals in the brain, we think that possibly patients who respond might be patients who have some abnormality in the way their brain processes pain, possibly because they may not have as much of these pain-inhibiting neurotransmitters. So our work to date will try to predict or to identify who might respond so that we can target the use of this drug to the people who are most likely to benefit. Thank you.